We start with breaking news at 6 as thousands of Providence doctors, nurses, and other workers walk off the job. It is the largest healthcare worker strike in Oregon history.
Thomas Schultz is covering it for us live outside Providence St. Vincent Hospital. So Thomas, the picket lines were supposed to begin right here at 6 o'clock. What are you seeing right now?
Yeah, well, guys, they've just begun, and those nurses have been streaming out of Providence all morning and hopping onto that picket line. Let's show you a little bit of what we're seeing. You're hearing those horns honk. We're starting to see dozens of workers with their picket signs up, all just coming out here in the past couple of minutes to begin that strike, which is a historic strike. The first time doctors are going on strike here in Oregon, and the largest strike in state history. Of course, this is going to have a big impact on patients across our area. 5,000 nurses are picketing at Providence locations across the state. For the first time, around 100 physicians are joining them, walking out of the Providence Women's Clinic and right here at St. Vincent. All are represented by the Oregon Nurses Association. And ONA claims Providence has deprioritized negotiations with nurses to focus on reaching a new agreement with physicians.
They've offered to negotiate with our doctors because they're not prepared for them to strike, and went on to say that they would not negotiate with our nurses because they are prepared for them to strike.
So Providence has about 2,000 replacement nurses coming in, though they do disagree with that characterization. They say that's unfair characterization of what's actually happening.
We have got one group that has agreed to bargain with us. That's a provider group, and that is the Providence Women's Clinic, and that is the only group that we're currently bargaining with.
Now, healthcare workers are asking for increased wages and higher levels of staffing. Providence says they're already mindful of those staffing levels, and they plan that well in advance. They do say people calling in sick or, other PTO reasons do lead to more increased packed hospital levels, and that can throw a wrench into their plans. Regardless, these healthcare workers are out here striking on the first day of this strike. Once again, Providence has 2,000 replacement nurses ready to go, but you can see a pretty significant line of nurses out here, cars honking as well. Now, for those doctors, Providence says that, once again, about 100 are striking. Those are not easy to replace positions. They say that can lead to delays at facilities like here at St. Vincent.